is an artificial opening, okay, a piece of the intestine is brought up through the stomach and will be secured and sitting on the abdomen, either side, depending where the resection happens, and stool will be coming out of here, okay? It can happen anywhere along the intestinal tract. So if it's up high, what do you think the stool is going to look like? Liquid or formed? Liquid, okay? As you move further down, okay, you can actually have fully formed stool, and some people will even have urge. They'll know when they have to have a bowel movement. They'll put the bag over top, and they'll actually have a bowel movement into the bag. Now that's huge control. Usually doesn't happen, but it is possible, okay? So stool is no longer coming out of the rectum. Okay, it's to give your bowel a break. Sometimes due to Crohn's and colitis, there's so much inflammation that you need to give that section a rest. And then sometimes this can be brought back down and resected, and then you can pass a bowel movement normally. And then other cases, this will be permanent for life. Okay? There's another option where if you have issues with your urinary tract, you can actually take one of your ureters. Do you remember what the ureter is? Okay, it's what brings the urine down to your bladder. You can take that, connect it to a piece of your intestine, and bring it up so that it'll come out of a stoma, but it'll be urine coming out. Okay, so that's pretty cool. It's all very cool. When you get to it, it'll all make sense to you. I know it's a little foreign right now, but a stoma needs to be a really red color, okay? This is a healthy stoma. If you ever see any brown or black or any sort of weird discharge on the stoma, it's dying, okay? And you need to let somebody know right away. So part of your assessment is to look, and a lot of the bags will be clear, so you can check that stoma out and make sure it's that really nice red color, okay?
Does it ever, like, just
bleed?
see? Yeah.
Yeah. Sometimes it does, and bleeding actually can be somewhat normal because the intestine's very vasculature, okay? If it's like pouring out blood, no, that's not normal.
I hate to be gory, but they have a lot of videos on YouTube.
Yeah, and actually here in our area, we have a huge population of Crohn's and colitis patients. We deal with ostomies a lot, so when you get in the hospital, you'll be doing a lot with ostomy, so that's why I like to go over it now instead of in one time. So that probably after Christmas we're going to see it, okay? The other thing we need to make sure is that the skin around the stoma is a nice, intact, healthy, good-looking skin, okay? So those will be your assessments to look at every time you have a patient, okay? Now to empty this is called the appliance, okay? Many different types. This is a two-piece. So this bag can come apart from the wafer. The wafer is what sticks to the skin, and the bag is what attaches to the wafer, okay? To empty this, I need to take this end, put it into something with graduation, so either this or your hat. I'm going to have gloves on, of course. You're going to release this clip, and you're going to let the stool go into here. Then what you're going to do is fill this with warm water. You're going to put it in the end and squirt all that in there. Swish it all around, clean out the bag, and then do it again until your bag is completely clean. Then what you'll do is you'll re-secure this. And so it's very simple. I'm going to show you. Okay? You take it. So see how it opens up? That's the end of it. You'll put it in like this. And you'll pinch down. You always want this flap to be up. If it's like this, it'll rub against your patient's skin and cause breakdown. Alright? So you want to make sure that this is up, so it'll rub against their clothing, and that this clip is very secure. If not, it's going to be a mess. Okay? And then the other thing to talk about is, so just as we pass flatus, okay, the stoma can as well, but it's attached to a bag. So what do you think is going to happen? When the gas comes through, it's going to become like a balloon. And if you don't empty that gas, it'll pop. Okay? So then you're going to have a stool or a stoma that people don't have control over, oozing everywhere. So you need to keep your eye on these bags. If it starts to even become half full, you need to empty it. And if you see some air going in it, what it's called is burping egg. I don't come up with these terms, but you need to burp the bag. So what you'll do is you'll empty the clip and just pass the air out, and then resecure the clip. And that's
Can they do that themselves too?
Sure they can. And people at home often, this is a long-term chronic treatment option for them, so they're very used to doing it all themselves. But people get sick, and this for other reasons, and this becomes almost unmanageable for them. They're weak, they're tired, so we do need to help them.
And how often do you actually change the bag and the skin?
Do you know what? I'm going to be honest. When I have a patient that has an ostomy,
Yep.
I will say, what is your routine?
Yeah.
How often do you change it? What products do you have? Walk me through it.
Yeah, because they know what products you put on their skin and.
Yeah, exactly.
Okay.
And that's how I handle every patient. I do what they do. Okay, and I think that's probably
So
the best.
this might be a weird question,
No,
but
nothing
like,
is.
since they go to the washroom and stuff from that, what about, does anything go on down here for them?
No, there could be some residual anal leakage a little bit, so you might have to put a little pad there, but typically no, nothing. And in fact, you can put a fleet enema into the stoma, and you can put a suppository into the stoma. Okay? So it won't be for your stool that's high up, because obviously it's already liquid, but for the ostomy or the colostomies that are further down, you can become impacted or constipated and have to put it into the
Especially
stoma.
if you see it with, I saw cancer patients, right?
Yes.
They have,
Absolutely.
and then more tumors and more blockades.
You got it. You've never seen it, eh?
No, I've never even
Okay.
Really?
Well,
about it, never.
so this is what I'm going to tell you, okay? It's very easy to maintain. It's a little messy.
And it's smellier than.
Yes, yeah. So those blue absorbent pads I'm going to put everywhere because there could be some leaking. And the other thing I see nurses do that's really gross to me is this has been like down in the poop, okay? You need to clean this. So take a face cloth and clean this because it's going to be rubbing on their clothing. Okay, so make sure you clean this properly. Some soapy water, okay? And like Stefan says, I just want you to be prepared. The smell is very strong, okay? So if there's a time that you might gag, I would say it could very likely be when you're emptying an ostomy for the first time. So be prepared that it's going to be it's not like any bowel movement you've ever had. Okay, it's very strong. Okay, in the beginning I almost couldn't do it as a student. I was like, I cannot empty this. And now,
It's nothing.
like nothing. I could probably eat a sandwich and do it at the same time. Okay, you develop a tolerance. There's a lot of self-identity issues with patients who have this. Obviously, their stool is collecting in a bag on the outside. They worry that, does it smell? Could you imagine being out at Walmart and your bag blow? Okay, so we need to work a lot with these patients and reassure them that this is saving their life. Okay, and my friend actually has Crohn's, and she literally lived her life, and she's young, in her 30s, where she could not grocery shop. Okay, a group of our friends would go and do her family's grocery shopping because she literally could not get from her house to the grocery store and shop without having to use the restroom probably 10 times because her diarrhea was so bad. My poor friend became so isolated in her home. She had no life. She couldn't go anywhere. And if she did, the first thing was where's the washroom? Okay? This became a treatment option for her. She really didn't want it at first, but she did a little bit of research and a lot of teaching and sort of support. And so she still has this now to this day. And let me tell you, her life is beautiful and amazing now. Okay? And so remember that it might be sort of weird to us, but this could be someone's life. She can now go to her daughter's school and watch, her Christmas pageant. Whereas before she couldn't, because even if she could get there, she'd be in the washroom for the majority of it.
Now,
Okay?
does everyone that has Crohn's have this?
No.
No way.
No. It's all very individualized. Often, actually, her Crohn's is a very bad case. She doesn't respond well to typical treatment. Where you see it a lot is with bowel cancer. Okay, so yeah. So just be very respectful when you're doing this, okay? And I'll leave it at that. Be very professional. Now, soaps at enema. Last one. Soaps at enema. We fill the bag with warm water, and in here somewhere, hold
1 liter.
1 liter. It's a lot of water. Okay.
Oh.
Okay, it's okay. Okay, take a deep breath.